Good afternoon, and welcome to the fifth session of our seventh annual Touro University, California Social Justice and Public Health Speaker Series, hosted by the Public Health Program. My name is Gail Cummings, and I am the Public Health Director for the Public Health Program here at TUC. The topic of this year's series focuses on mental well-being and the complex intersections between COVID-19, the pandemic, structural racism, and inequities in mental health through the public health lens. So for those of you who are joining us for the first time, we are continuing to examine and untangle the root causes, implications, opportunities, and solutions of these competing public health crises. We are hearing from and having conversations with public health researchers and social justice advocates working towards health equity and transformative change. While today's seminar will focus on what's happening in our local community here in Vallejo, these issues are universal and impacting communities across the country who are experiencing state-sanctioned violence and the pervasive impacts that affect the mental health of individuals, families, and communities. The title of today's webinar is The Impact of Police Practices on Mental Health, Lessons Learned in Vallejo, California. This session is particularly important to me and the TUC community in terms of the research aspects, which really grew out of a couple of areas that produced what I consider to be a perfect synergy. Civil rights attorney Melissa Nold and Dr. Alan Caesar, who you'll meet shortly, really did help to initiate conversations with family members and community partners supporting those impacted by police violence, and sought partnership with the Public Health Program in 2019. This really planted the seeds for collaboration between local leaders and community-based organizations doing this work. And at that point, I was only tangentially involved. I got more involved last summer after the murder of George Floyd, as I helped to oversee a preliminary study conducted by TUC students who were members of White Coats for Black Lives and who conducted a community engagement study to investigate community perceptions of the Vallejo Police Department. This work also intersects with our involvement in TUC's Public Health's newest concentration, Health Equity and Criminal Justice, which addresses the impacts of incarceration on the legal system, on individuals, families, and communities within a public health framework. All of this evolved as public health as a discipline was just beginning to make the connection between toxic stress produced by racism and stress-related conditions like heart disease and diabetes. And in fact, the American Public Health Association and many public health departments nationwide were just beginning to declare that racism and violence, and law enforcement violence in particular, were public health issues. Building upon this recognition, we clearly understood that further work needed to be done to understand how violence and biased police practices were impacting the mental health of communities like Vallejo, as there was little research available. It's really our hope that the data gathered from this study that we will be discussing today will be the first step to help healthcare practitioners and policymakers in Vallejo make more informed treatment decisions and policy decisions, and aid in the development of community-based programs oriented toward prevention and interventions. We'll have two presentations today, which will include a discussion of the landscape of law enforcement violence here in Vallejo and its impact on individuals and their families and the community, and the impacts, to be followed by findings from our recent study titled The Vallejo Impact of Police Practices. Following both presentations, we'll have a Q&A sessions, and you'll be able to submit your questions using the Q&A function in Zoom. Just as a quick reminder, CME credits and CPH credits are available. And for students enrolled in this course, please complete the assignments that are associated with today's presentation. So without further ado, I would like to present and introduce our first presenter, Melissa Nold. JD graduated from the University of California Hastings Law School in 2015. She worked for civil rights attorney John Burris of Oakland, where she became an integral part of a team litigating high-profile civil rights cases, including police misconduct and wrongful death, all over Northern California. Additionally, Melissa's unique background as a former deputy sheriff and deputy coroner provides her with invaluable insight in investigating cases involving police activity resulting in serious injury or death. In early 2019, Melissa went into private practice in her hometown of Vallejo. Melissa is focused on police reform at the state and local level and advocates for victims of police brutality in and outside of the courtroom. Melissa is very active in the community as a police reform advocate and fights side by side with the community to change the culture of violent policing in America. Please help me welcome Melissa Nold.
Thank you, Gail. Yes, I got involved in what was going on in Vallejo around the time that Willie McCoy got killed in 2019. Prior to that, I'd been doing civil rights work and not really necessarily understanding the impact of police violence on the families. And, you look at it as something you kind of see on TV, some sort of one-off situation. And then after I got more deeply involved in the advocacy portion, that's when I started to really see the mental health impacts of police violence. It's been targeted in Vallejo for me because this is my home. This is the place where I was physically able to go to attend, city council meetings, to go to rallies, and to do things organized around the violence that was happening here. And when I really got, transitioned from your traditional lawyer 9-to-5 courtroom into doing sort of the client portion of it and figuring out how we could work to reduce the police violence in Vallejo, I began to realize that one of the biggest issues beyond stopping the police violence, which is kind of its own problem, is how do we support the people who've been impacted by the police violence? What resources are available to them? And came to find out that unlike your traditional victims who have victim services and things that are, provided to them by, say, the district attorney's office or by the state, police violence victims, people whose loved ones have been killed, people who've been brutalized by the police, are not eligible for those services. They don't, for example, if your son or daughter or wife, husband, parent gets killed by the police and you're struggling, there's nothing there for you. There's nothing set up aside for you to even be able to get time off of work. Unlike a normal victim where there's, those services and funds available, so you can say take a week off to grieve. Is that the families end up in situations where they have to go to work the next day. And if they, oftentimes the police, people that are being killed by the police fall into groups that don't have great, leave packages. They don't have paid family leave. They're working in positions that don't allow them to be able to survive. And then there's just no resources for them. It went as far for me to, looking myself to try to find out what can I do to get, to find the resources. I was ignorant, and I assumed it's just because the families didn't know how to look. I was like, that's my own privilege of saying, okay, it's there. Maybe I'm just smarter than you and I can find it. And so I went and scoured trying to figure out where can I refer, impacted families, many who have witnessed the violence against their family members. Where can we send them to get, to get resources? And finding out there's nothing specific. There's nothing specific to this particular issue. And we located one person who was working with an advocacy group who was volunteering her time to do counseling for impacted families. And she was, because of the lack of providers available, she was essentially covering Northern California, hundreds and hundreds of families. And, she was, besides her full-time job, that she was taking her evenings and weekends and late into the night, trying to support as much as she could, to the point that it started impacting her mental health. And it's literally one person trying to support the families. And at some point it became me supporting people's mental health needs as a non-mental health professional person that's in no way qualified to do that. But because, traditionally the route to getting emergency mental health services are calling 911. And if your family member has been killed as a result of a 911 call, you're not calling it, because of the fear of trying to, you're suicidal and you call 911, the police are coming. And the fire department may eventually get there to get you the resources, but it's the police. And so it's a deterrent to have to go through that route, to have to go through the powers that be that have caused this harm to your family to even get the services needed. And ended up having to gather up allies in the community to go to people's homes that were in crisis and literally wrapping them up in blankets and taking them to the doctor. And it was just shocking to me that there wasn't anything in place to help assist people. I've unfortunately had in the last few years countless clients who've been ultimately diagnosed with PTSD, depression, anxiety, suicidal attempts, suicidal ideations. I've had multiple clients that I've had to talk down from suicidal ideations, suicide attempts, and these things I'm not qualified for. And but at the end of the day, I had to be the stopgap measure because I know that they're not going to call the police to get services. And it's like I said, it's just been shocking to me how little of a resource that there even is. Even when you think about things that are traditional, like say grief counseling, group counseling, say for people who've lost loved ones to community violence and things like that. Well, victims of police violence don't necessarily fit into that mold. And oftentimes the people who have experienced tragic loss of life, say through violent crime, there's a potential for there being some sort of justice related to that. And so it's this sort of disconnect. I've had a number of clients who've tried to engage in communal counseling situations or other grieving families, but it turns out that they really only find a kinship with people who've been impacted by police violence. And it ends up being people who are deeply traumatized themselves, who are becoming the shoulder to cry on for the other impacted families who've been impacted by police violence, because they just don't relate to people. If your son or daughter gets murdered and there's the possibility that somebody might get charged with a crime, somebody might get convicted of a crime, there may be some semblance of justice at the end of that. Well, that's not the case for people that are victims of police violence. If you lose your loved one, there's an excellent chance that you're going to see the person who killed your loved one driving down the street, patrolling your neighborhood. And, we've got people in Vallejo whose loved ones have been killed in front of them who have been taunted by the police. And so it's just, they exist in this world that's very different. The trauma is very different in many ways. And it ends up being the families that are providing this support to themselves, or me and other people that are working as advocates providing the support, and we're sort of all traumatizing one another, as opposed to having people that come in and that know how to counsel, to know how to deal with the grief. And we don't receive any training, but it sort of lands on us. And so part of out of my own selfishness, since it landed on me, it became an area of interest for me, because I have to be able to function and do my job while engaging in ingesting the trauma myself, and so it became a matter of how do I maintain my mental health while dealing with people that are struggling when there's really no resources. And I can't just get a client that calls me at 11 o'clock at night and says, I want to kill myself. I can't get off the phone. I'm going to be dealing with that, going to their home. And it's become something that, when we started looking outward, I was just glad that Touro had actually showed some interest in it. So you guys were the first organization or group that actually showed any interest. We reached out to all sorts of organizations, and everybody had their own focus, and this just wasn't what their focus was. And so looking at it from my viewpoint, you see these family members, almost all who come from traditionally vulnerable communities, who were already had community trauma. They came from various backgrounds where there's been poverty and oppression and racism and all of these things that they were already dealing with on the day-to-day basis. And then you stack the murder of their loved ones, the state-sanctioned violence, you add that on top of what they're dealing with on a day-to-day basis. And you just wonder, oftentimes, for me at least, how do they stand? And some of the strongest, most powerful people that I know have lost loved ones, and and they're battling through in ways that they shouldn't have to. that we want to see the, figure out how to, like you said, get the research done to figure out what the issues are, to try to get funding and try to get things so that when this happens, we actually have somebody to direct them to. I've had many clients that really needed to speak to somebody about things, for example, where they were having homicidal ideations. I don't know if that's the term. I don't know what you would call it, where they're wanting to seek vengeance. And it's I don't know how to talk somebody out of wanting to harm the person that harms, so all of these different levels of things that are just stacked on top of everyday people who are already struggling, and it's not just the impacted families, it's the people that learn about the impacted families. It's the family members, the friends, the neighbors, all of the community. Like in Vallejo, there's very few people I know that have comfort to be able to call the police if they need them. And as a result, other crimes are rampant because we don't want to call the police and end up having somebody get murdered because we've called because of a property crime. We don't want people stealing our stuff. But how do we do that knowing that they may come and use violence over items? And I just, it breaks my heart. The more I do it, as like when I first started, I was a lawyer, and as time has gone by, I've become more and more of an advocate. It's been because it's more personal to me. I've ingested so much of it. It's become something that, that my life work has transitioned into figuring out how to get the police to quit killing people, because I know that I can't bear the personal weight of the loss of any more human beings. And so I appreciate deeply the work that you guys are doing, because I know that until you research things and figure out what the components are, nobody can really do anything about it. There's not an opportunity to have funding. We have people in Vallejo, the schools don't have any resources for the kids who've been impacted by police violence. We got families in Vallejo who have children who've witnessed police violence, death by hands of police. There's been no resources for them, and they're still bringing in police to do presentations in their classrooms, and with no recognition that there are children who are terrified of the police. People who, some of my clients whose family members, children, young children, watch their loved ones getting killed, and the schools don't target them for assistance. There's nothing that's put in place right now to give a resource of just somebody to talk to. I'm currently effectively forced to have family members lean upon one another, because it's somebody that can relate to what they're going through and is going to be compassionate and patient, and the things that we would like to have people that can support the family members who are not being re-traumatized by hearing about it. Because every time you hear about another person and the injustice they've been experiencing, intimidation, threats from departments, all these myriad of things that are going on, it incenses and angers and hurts the person who themselves has experienced it. And then the families take on the grief of one another. And it becomes, when somebody else gets killed, they get pulled into the fold of this community of impacted families who have been forced to use one another as the resource to give them strength and hope. And it's terribly depressing to see the families who have nobody but themselves to lean on. They've been an amazing resource and support system for one another. But my God, should they have to be? That's really what, to me, it shouldn't be like this. And so watching that and seeing how it's impacted all aspects of the community, of, like I said, of us not wanting to utilize the police resources, the terror. I just can't explain how many times people come and talk to me about the terror that they feel when they see Vallejo police. And I'm talking about upstanding, law-abiding, no possible reason why the police would target them, but it doesn't stop that just intense feeling that they might just get behind me, pull me over, and murder me because I sneezed. And it's, those kind of things that impact people's ability to comfortably drive down the street. All of these levels of things that we're dealing with, it has gotten better in the sense that Vallejo is now under the scrutiny that they were not under in the past decades, so that there's more attention to everything that they do. But even the change in reform, even if they stopped killing people today and never did it again, that doesn't take away the harm that's already been caused and the deep wounds that are in the community. And we're all trying to figure out how to work together to heal the impacted families and all of the, it's like an earthquake, all of the vibrations that come. The family themselves feel the hardest of those vibrations, and then it radiates out into the community to the point where we don't want to utilize the police services. And just seeing them makes, like, every time I see the police, I get terrified. I'm not a target. The police, they're not. I'm a middle-aged, affluent white lawyer who they know. I am not a target, and I'm still afraid that something might happen because of the advocacy. So, I mean, imagine. I can't even imagine how a person that's actually vulnerable feels. Somebody that has to walk down the street and can't drive down the street, and there's a lot of people in town who don't really leave that often because they're afraid of what might happen, not just violent crimes and things like that, but because the police have been out of control. And so, I just continue to work and figuring out what I can do to support not only the families, but everybody that wants to support the families. Because like you said, 2020, everybody, George Floyd, the season of George Floyd was something that, the season of George Floyd it's a seasonal outrage that a lot of people had. And everybody was like, oh my God, this terrible thing just happened. And I'm going, this happened 8 times in the Bay Area in the last 5 years, and the exact same circumstances, some of them much worse than what happened to poor Mr. Floyd, where people are screaming out on video, I can't breathe. And it became sort of this thing where the impacted community in Vallejo came out, and there were rallies and things going on, and hundreds of thousands of people that popped up. And when some of the impacted families wanted to speak about what happened to their loved one actually in Vallejo, people tried to silence them and tell them that we were off topic. And it was just this painful thing to see, this sort of national outrage that now has essentially disappeared. It's all but gone now. We went from thousands of people, and then now we, try to get people together, and we're back to having between 20 and 50 people show up. And so, we got this season where there was like hope, and it was painful to watch it kind of dissipate. And now we're back kind of where we were in 2019. The police are more on notice, but we're still dealing with the absolute lack of resources, the absolute terror that still exists. And nobody wants to deal with this sort of elephant in the room. And so, like I said, appreciate that you guys are here. Dr. Caesar has been involved in this since probably around the same time I was, just kind of deeply invested in trying to figure out what can we do as privileged, affluent people, these educated people, what can we do to mitigate these harms that have been caused, and what, and what of our resources can we put forward to make the change to at least, it would be amazing. I have people right now, years of living with the impact of police violence, they still haven't seen resources, and even 5 years from now, they'll still need resources. So we're just here, to support whatever we can do to try to push this forward, so that we would have somebody to call when things like this happen, that we would have people that would be willing to, to put forward their time, to have those conversations with impacted families. I have very few families that I work with that the family members or the people impacted themselves don't have PTSD. Almost all of them end up with PTSD. If you don't have PTSD from personally observing the thing that happened or the loss, it comes from being terrorized by the police afterwards. Because if you were a physical victim and you survived your injury, most of the clients that I have that had any kind of baseline anxiety, just the normal stress and anxiety, depression, things we all deal with on kind of a daily basis, usually, like those, I've watched a marked increase, because I may end up looking at all the medical records and stuff, this marked decrease in a person's mental well-being. And people who've had, these layers of trauma, you go from somebody who had sort of a 10 or 20% impact on their daily functioning, getting down to the point of like an 80% decrease in their daily function. And then it affects their ability to go to work, support their families. And it just then reverberates throughout the families. I've had families I've got a client right now whose daughter was killed by the police, and she has not been able to really get out of bed. And to be able to get those resources for her. She doesn't want to do it. You can't force her to do it. The only way you can force her to do it, even though she can't really do even self-care, she's really under like a 5150 standard. She's gravely disabled. She won't feed herself. She won't go to the grocery store. But the only way to get her resources is to physically take her, like wrap her up and take her to a hospital or to call the police. And unless you're willing to do one or the other of those things, there's no way in the world we would call the police to her home. She would rather die of a broken heart than have to deal with the police. And so, like I said, and what her baseline was, I'm not sure, but I know that she functioned before this. She worked, and the impact of it is something that I don't know that ever gets better, but I know it's not going to get better if she doesn't have anyone to talk to. That she doesn't have anyone to be able to support her attempts to get well. And so, that to have medical professionals become aware that this is another type of trauma, that this is a debilitating trauma in the same way that war is, in the same way that long-term abuse is. It's really important for people that are evaluating patients and people to realize that when a person says they've been impacted by police violence, they've been beat up by the police or lost a loved one, is that there's a dense network of things that are going on that they need support for. And so any additional resources, or even just, like I said, somebody having a compassionate word, because oftentimes when people go to even talk to professionals, when you say you've been a victim of a police violence and you go to the hospital, they're treated very poorly. People go in getting beat up by the police, go into the ER, they're treated like criminals. And oftentimes I've at least a dozen times had clients who went in after being beaten up by the police. They had broken bones, they had concussions, and they were sent home and treated as if they were addicts and came in for medication. I've had to go to the emergency room with clients and compel the hospitals to do examinations, to do CAT scans, to find out that people had broken noses, broken jaws, concussions, and and we're getting that frontline treatment. They were getting treated as if the fact that you were attacked by the police means you're a bad guy. And so even just realizing that people have been impacted by police violence, even if you did something wrong, you don't deserve to be abused, but a good portion of the people that have been abused haven't actually done anything wrong. And so kind of destigmatizing victims so that frontline workers, emergency workers, healthcare workers realize that doesn't mean that you're a criminal, that you deserve to be abused, that you should be dealing with a victim of police violence the same way as you would be dealing with a victim of domestic violence or family violence or community violence, because that disconnect and that maltreatment of a victim isolates them even more, and it becomes where you would normally go for resources. There's nothing. And like I said, I had to travel up to Sacramento when my client was dizzy for 2 days and they were telling him he was fine, and had to sit there in the ER and tell the doctor, I'm a lawyer and I'm going to sue you if you don't, get my client a CAT scan, and to find out that he had a bad concussion, that he had a broken nose, that his jaw was broken, and they disregarded him. And to the fact that I had to do that I was, that there was not even any advocate groups that were available. There was no healthcare professionals. There was no resources that we could respond to. I'm one person. I have 5 kids. It's only so thin you can spread my time before I'm 24 hours a day. And so, wanting to figure out how to get the healthcare workers to understand some of those things is extremely important to me, because it means more resources, it means more help, it means more hands. And so that kind of is my viewpoint on it, from, obviously a non-medical professional, but kind of the boots on the ground. This is what we're dealing with on a day-to-day basis. It doesn't matter how long ago the violence happened. I see Chris is here. Families got impacted 10 years ago. They're still dealing with the day-to-day impacts of the violence, the lack of justice, the disregard. It never gets better. It never gets old, and so we've got people going back decades that desperately need resources that can be allocated to their mental well-being. And so that's, I'll yield.
Well, I just need to take a breath, Melissa. Thank you, basically, for all that you do, for the work that you do, your passion and humanity to this work. We just thank you. Just providing the multi-layered impacts of the state-sanctioned violence and how that impacts the mental health and well-being of not just individuals, but the community as a whole is extremely eye-opening and an important aspect to understanding how that is connected to medicine as well as the societal impacts. And so we really appreciate you kind of putting a human face on that and making building that scenario and narrative that is so important. You brought up so many thought-provoking issues around destigmatizing folks who are victims of state sanctioned violence. There's so many questions and comments in the chat, and what I would like to do is hold those off until after we have our next presentation, and we can actually have a conversation and answer and comment on some of the commentary coming through the chat. So thank you, Melissa.
And as mentioned, there are some impacted families that are in the chat right now. So some of the comments are not really questions necessarily. They're just kind of, it's their experiences that are kind of coming out. So I think some of the impacted families, that they're not really trying to start the conversation, but more so just to kind of let us know that they're there, that they've been crying out and they're here now. So I just want you guys to know that they're here because they want to figure out these issues too. But for the most part, they're, when it comes to panels and things like that, a lot of times they're not on the panels. Their voices aren't being expressed. A lot of times they're intentionally left out. I'm going to jump into Dr. Caesar's time, but we've had recently, the Department of Justice came out. We've had various people that wanted to interact with members of the community, and they intentionally left out the people that were actually impacted by the violence. And so I just want them to know I see them here and I see them all the time. And I just want everybody else to know they're here with us. They're not, no offense, I just didn't want them to be silenced during this process while we're talking about literally what they've experienced. So I just wanted to say that while I see some of the comments popping up, that I hope they have the freedom to commentate as we go along, because I can't speak for them. I don't speak for them. I speak for what I observe, but they're all willing and able and interested in speaking for themselves when they get the opportunity to do so. So I just wanted to say that. I'm gonna mute myself now.
Thank you, Melissa. And no, what you said is so important. And that is one of the things that we are trying to do, is provide that space and that platform, because as you say, that's critical in terms of really having a true understanding and building empathy and strength around this issue. So thank you for noting that. And I have seen that also in the chat, and it is something that we it's something that we are also working on and well aware of. So I appreciate you bringing that to our attention. So to continue this conversation, Melissa you did an excellent job in terms of sort of laying the groundwork and landscape for what's been happening in Vallejo, how families of police violence, what they are faced with, the tremendous challenges that follow as a result. I'm really, really privileged to introduce Dr. Alan Caesar and Anika Lee, who are researchers on the Vallejo Impact of Police Practices study, and will be providing some findings from some preliminary results of a recent study just conducted. And I want to give a little bit of both of their bios before we get started. I know, Alan, you're getting screen ready. As you get your screen ready, I'm going to introduce Anika Lee. First, she is an MPH student here at Touro University. She is a Bay Area native and received her undergraduate degree from St. Mary's College in California in 2015. She began the public health program in 2020 and is on track to earn her MPH in December 2021. That's just in a couple months. Anika became a Touro Social Justice Fellow in 2020 and was integral in the launch of the VIPP study. Working as the study's research assistant, Anika has helped form partnerships between the university and local Vallejo organizations that promote advocacy and solidarity among those affected by police violence. Anika presented study findings at the APHA Association Annual Conference. That's the American Public Health Association Annual Conference just last week, reinforcing the importance of recognizing that police violence is a public health issue, particularly in Black and Brown communities. She believes that providing a platform for marginalized voices is not only important, but critical for healing and change. Anika serves as a research assistant on the VIPP study. Dr. Alan Caesar, who is a co-principal investigator on the VIPP study, received his PhD in psychology from Washington University in St. Louis and completed postdoctoral work in cognitive neuroscience at Stanford University School of Medicine. Dr. Caesar's research focuses on understanding how brain systems work together to enable complex cognitive processing, how psychiatric illness disrupts these systems, and how stress impacts physical and mental health. Dr. Caesar began to appreciate the importance of studying mental illness while serving in the U.S. Navy as a combat medic and neuropsychiatric technician. He has 10 years of clinical experience in the fields of psychiatry and psychology and 8 years of research experience in cognitive neuroscience. For the last 2 years, Dr. Caesar has been studying the intersection of cannabis use and health outcomes in Vallejo, California. Please help me welcome Dr. Alan Caesar and Anika Lee, who will be presenting findings from Vallejo Impact of Police Practices study. Thank you.
Hi, everyone. I think Anika, are you presenting any of these, or is it just me? Fine either way.
I am presenting more so in the recruitment and methods.
Okay.
So all right,
you. So yeah, I'll just talk a little bit about the background. Like Melissa was saying, I got involved in this around 2019 after hearing about Willie McCoy's killing, and I was working in Vallejo at Plantacia, which is a cannabis company. They had a shop that was they merged with someone else, but I was doing work in that area, and I spoke with my boss about some of what I was hearing about going on in the community around police violence, and she encouraged me to kind of get involved and see how we could help. So I went to, I think one of the first meetings I went to was at Melissa's law firm. It was a hot summer's day. I think it was August or something like that. The AC was out. Everyone was packed into this room, sweating and listening to some of the families share their experiences, and some other people talk about, information. So I am definitely not, I recognize, policing as the kind of enforcement arm of colonial, agenda, and I'm not really interested in kind of reform. I think, I think, the police are inherently violent. And I'm interested in alternatives to policing, I guess prison abolition kind of thing. So when thinking about my own contributions, how I could show up, how I could use my skills and my platform and my education to make a contribution to this effort, I was thinking about research. I was thinking about my background and experience in mental health. I was listening to Melissa talk about the ways in which families, continue to be impacted even after, lawsuit settlements and civil settlements. Listening to the families talk, about their experiences at city council meetings and at demonstrations. So I thought, there needs to be a lot more, resources available to individuals impacted by police violence. And I think it's important to understand the kind of scale of exposure to police violence and what sort of things people have been experiencing in the community. If we can demonstrate, a link between what's going on in the community in terms of being exposed to police violence and how that's impacting people, their well-being, aspects of their well-being, then, we can kind of make a case for grant funding and all these other types of funding to kind of bring resources. But it's not up to us, to decide, what resources get brought in and for what. So my thought was like the first step is really kind of getting in there, engaging with the community, trying to set up an infrastructure for collecting some data around this. And then once we do that, presenting the data to the community and starting a conversation about, where we go from here, what sort of things we want to be building towards, and what's needed in the community, because it's not something that, we can determine for the community. So I think I really appreciated that about Gail and Touro. I've been really interested in kind of bringing, the community in to this work, and creating pathways for supporting the community. So let me go through some of these slides. So no disclosures. The funding for this project came from Touro, an internal grant that we applied for. Just want to do a land acknowledgement. So the city of Vallejo exists on unceded indigenous land of confederated villages of Lisjan, I'm not sure if I'm pronouncing that right, as well as the Karkin, Wekma, and Patwin peoples. And I want to give a special thanks to families of Eric Reason, Angel Ramos, Ronald Foster, Willie McCoy, Sean Monterosa, and other families impacted by police violence and community members impacted by police violence. When we were engaging with the community, a lot of people were really supportive of this work, and it wouldn't have been able to happen, as we'll talk about, without that support. So I just want to acknowledge and appreciate all the families who have been impacted by police violence and who are dealing with this, like people are saying, on a day-to-day basis. So this is a slide that just talks about some of the ways in which police violence is unique from other forms of violence. And this came up, I think, in some of the chat comments, and Melissa was talking about this too. But police violence is different in a number of ways. First, it's state-sanctioned violence. Police are pervasive presence. There are limited options for recourse. If someone experiences violence from the police, there's a culture problem in policing that prevents accountability, and police violence alters deeply held beliefs, which we'll talk about in a minute, but it kind of shapes your worldview. They're racial and economic disparities and exposure. So certain groups are impacted more heavily than other groups. It is stigmatizing, like people were saying. If you go to the emergency room, like Melissa was saying, and you tell them that you've been assaulted by police, there might be the assumption that you're in the wrong, which impacts your access to care and the quality of your care. And police are typically armed, so they're just out in the community armed, and people who've had, violent experiences with the police might feel a little uncomfortable knowing that some of the perpetrators of this violence are still out patrolling. So this is not my slide. Community perspective.
Anika, would you like to address the slide?
So before I started on the study, there was a study in the spring of 2020 that was a group of Touro students that did community engagement surveys to really understand the community perceptions of the Vallejo Police Department, and they reached 286 residents. In the initial survey, they really outlined an OIR report that was given to VPD on how to change their practices and how it was affecting the community. And after VPD statements of really not using the feedback, Touro University made a formal statement saying that VPD was not allowed to practice on campus. This came from the concerns from the survey results that many residents felt that there was inadequate training and timeliness or not responding to calls for services, and that the officers were not culturally equipped to serve the needs of the Vallejo community. And about 240 out of the 286 believed that the use of military grade practices was not necessary, especially in nonviolent protests. And they actually supported allocations of funds to, instead of VPD, to mental health and social work. And so the fourth step is when I came in with the Social Justice Fellowship in the fall of 2020, when we launched our survey of the Vallejo impact of police practices. And we created that in the time span of creating the survey on Qualtrics from August 2020 till about February 2021. And we also did our networking then, and then we started the actual launch of it in March of 2021. Do you want me to continue?
I can do these two.
Okay.
So yeah, so there's some, one of the issues, Melissa kind of touched on this, but this isn't particularly well studied. I was kind of shocked to find that out. There's growing evidence that suggests exposure to police violence can have toxic effects on physical health through stress sensitization, mental health. People with PTSD, they have increased threat sensitivity and stress sensitivity. So, stress and arousal can be easily triggered. And if you kind of have elevated levels of stress on a day-to-day basis, that can kind of have a corrosive, toxic effect on the body. So like Gail was saying, public health is starting to recognize the connection between, aspects of racism, including police violence, and toxic stress and health problems. And there's also some evidence, that the police practices in Vallejo are kind of, worse than other neighboring counties. There's been a lot of problems, like Melissa said, a lot of investigations. So it seemed like an important place to be doing this work and supporting family members impacted. So this is just a quick, one of the studies was looking at cognitive appraisal on the relationship between exposure to police violence and mental health symptoms. And cognitive appraisal is really kind of like your beliefs about the world, beliefs about yourself, beliefs about others, and beliefs about the world. So if, people who have a traumatic event, their beliefs about the world or themselves or something might change a little bit. Whereas before they might have felt safe in certain environments and not really thought about, potential threat. But after a trauma, people are much more sensitive to these threats and kind of like on the alert. There's something called hypervigilance, where people are always kind of watching out for some danger. And again, that is that heightened stress, heightened level of arousal, and we're not meant to be at that state for long periods of time. So that heightened level of stress and arousal can be fueled by some of the beliefs that we have about the world. So, and that those beliefs kind of maintain some of the symptoms of PTSD and trauma that people have experienced. So someone commented, how can we heal if unless there's been reform? That is definitely a question that I, had to sit with for a while in doing this work. And, the conclusion that I came to was like, it's kind of like a yes and, I don't think we have to wait till, police reform has happened to start the healing process. There are people who've been, harmed, decades ago or longer, who need, resources and support. So the reform, alternatives to policing aspect, like that's not my background. I want that, but I can't do anything about that. But what I can do, is support that work and also use my skills to kind of like bring about support on some of the healing that's needed from this. So the goals of the study, to assess the levels of exposure to police violence in Vallejo, assess the scale of the impact of this trauma, examine relationships between exposure to police encounters and mental health. There's some work showing that, there is a relationship between exposure to police violence and mental health, but there aren't a lot of studies on this. And determine whether post-trauma cognitions kind of moderate the relationship between exposure to police violence and mental health symptoms. And essentially what that means is, does post-trauma cognitions have an impact on the relationship between exposure to police violence and mental health symptoms? And if it does, it suggests, a possible route of intervention. So I'll talk a little bit about how we kind of approach that.
So our recruitment efforts really started with the CVPR approach. And in our public health program at Touro, we all know that as the community-based participatory research approach. And we use this in the design of our survey content, as well as our delivery of the survey. And also kind of, we took their feedback in supporting mental health services and having them in place while participants took the survey. So we had, Solana County mental health hotlines available. Us as part of the study group, we were also available for any people that may have had some trauma response while taking the survey. We thought that was really important, as well as we took the feedback from our community partners on how to reach the unhoused community, how to reach people that, may not have services as far as like internet services and things like that, because the survey was mainly virtual. And we used 8 community organizations in Vallejo to recruit adults who may have had interactions with the Vallejo Police Department. And they were the Willie McCoy Foundation, Vessels of Vallejo, the Vallejo Project, Fighting Back Partnership, Vallejo Peace Project, Open Vallejo, and Frontline Activist Movement, as well as Touro University. We recruited the adults from 5 zip codes of Vallejo and neighboring cities, and the surveys were self-administered either through those organizations' direct email or website, or Facebook or Instagram, as well as we provided a QR code and a hyperlink that sent them directly to the survey. Next slide. So the IRB approval was obtained through Touro University. On the left-hand side, you can see the flyer that was the flyer that we had the organizations either send out via email or physically, and that was at like farmers markets, at their offices as well. And it had our contact information in that QR code, as well as we used an incentive for every 50 participants. They did have a chance to win a $250 Visa gift card. The data collection occurred from February 2021 through June of 2021, and informed consent was obtained, and it was a self-reported 111 item questionnaire of quantitative as well as open answer. And the open answer was really important in order for us to understand more perceptions of police impacts, as well as to help understand families impacted and their, I would say, a gauge of like mental health scores as well, past the quantitative range that we got. So we found that those replies were like really meaningful and something that we will take further in our next phase. I think we're...
Alan, are you frozen there?
Okay, so the measures we had.
So for assessment measures, that would be the next slide. We did a physical health and mental health score, and they were measured with a 20-item short form survey. And we also did mental health assessments, including the 9-item patient health questionnaire, the generalized anxiety disorder, which was like a 7-item scale. And we also used a 27-item police practices inventory. The police practices inventory is developed based on the 4 World Health Organization's domains of violence, including physical, psychological, sexual, and neglectful. And this measure also includes items assessing positive interactions with the police using a similar format. The data reduction was applied to the PPIs such that each was yes and maybe as a response, endorsing a type of police interaction that was coded as 1. And the follow-up responses regarding the frequency of exposure was coded as 0 for never in the past 2 years, 0.25 for once in the past 2 years, 0.5 for 2 to 4 times, and 0.75 for 5 to 10 times in the past 2 years. Should we wait or should I keep going? To test the hypothesis that post-traumatic cognitive appraisal moderates the relationship between exposure to police violence and symptoms of depression, there is a hierarchical multiple regression analysis that was conducted. And this is really Dr. Caesar's expertise on cognitive appraisal when it comes to exposure to police violence and post-traumatic cognitive appraisal. Did you want to speak on that, Dr. Caesar?
Yeah.
Okay.
So I had to log onto my phone. I don't know what happened to my internet, but it just went out.
Okay, we're right on your cognitive appraisal slide. You're muted.
Anika, can you
Sorry about that.
Can you share your screen? Can you share your slide?
Yeah, I can try.
Okay. Please forgive
Yeah,
our
so there's
technical difficulties here.
The police practices inventory is a questionnaire that was developed based on kind of 4 World Health Organization domains of violence, including physical, psychological, sexual, and neglect.
Please stand by as we figure out our technical difficulties. I think we're going to reshare the screen so we can see the presentation. And I believe Dr. Caesar is going
for personal exposure, and then another score for kind of witnessed exposure to police violence. Can you hear me okay? All right. So yeah, so we used depression as the dependent variable, and then we looked to see if exposure to police violence and post-traumatic cognitive appraisal, how people kind of felt about themselves, about other people in the world after having that violent interaction with the police. So we wanted to see if that was predictive of depression scores. And then we wanted to see if the combination of those two, the interaction of those two, predicted depression scores, even when you accounted for those 2 individually. So does she have the slides up yet?
She's trying to upload the slides.
Okay. Okay.
She's also experiencing internet delays.
Yeah. Yeah.
Can you reshare?
I am still using my phone. I don't know why my internet is not working right now.
Okay. If you continue to speak, I'll see if I can pull it up from the Google Doc.
Okay. Yeah. So one of the questions was, are there interactions with race? That was one thing that we were kind of looking at explicitly, and really focusing our recruitment efforts to make sure that we got kind of representative samples for the Vallejo community. So we were kind of tracking that pretty closely, and our final sample included about 22% Asian individuals, 17% Black individuals, 36% white individuals, and 6% Latinx, and 7% multiracial. So the biggest group was white individuals. And I do know that, according to the census figures, we were somewhat under recruited for Black individuals. But so we opened up the study again to try to increase recruitment, and we're able to bump those numbers up a little bit, but it was still kind of below what we wanted. So there were some limitations in terms of recruitment strategies because of COVID, and we kind of did our best. I mean, this project was started before pre-COVID, and then we kind of had to make some adjustments. Let me email it to. All right, and then our sample was primarily younger individuals. About 47% of people were 18 to 30 years old. About 28% were 31 to 45. So the majority of our sample was under the age of 45, and then we had 16% of individuals who were 46 to 60 years old, and then 9% of individuals were greater than 60 years old.
Well, everyone is having technical difficulties. I'm going to say we're going to take a 5-minute break.
So I have some figures on this too, but the zip code, Vallejo zip codes are 94589, 94590, 94591, and 94592. So we had about 18% that were from 94589. About 40% were from 94590. About 30% were from 94591, and about 8% were from 94592. So were we able to? Awesome. Yeah, so let me try to talk through some of these tables so we're not just sitting here. Yeah, so one of the things we did was we looked at some of the demographics of these different zip codes and whether or not these zip codes were kind of differentially impacted. I have some numbers on that, but it's kind of a lot to walk through. But I will say that, you know, the largest percentage of individuals
Dr. Caesar, what I can recommend is maybe you can log off and log back on. And while you do that, what we might want to do is it sounds like you might want to log back on. And while we wait for the slides to reappear, perhaps we can open it up to a conversation with our community and our panelists. How does that sound?
Yeah, that works.
And what we can do is we can come back, hopefully before our time is up, and present the remainder of the study findings. But what I'd like to do, per some of the chat and discussion that we have about some of the individuals who we're really privileged to have on our call today, I would like to make time and space to allow them to introduce themselves. Actually, and it looks like the presentation is back up in the... I don't know, can you see that, Dr. Caesar? Okay, what we're gonna do, because we are riddled with technical difficulties today. I know we can see the slides, but it looks like Dr. Caesar is frozen. So what I'd like to do is pause until we can get a internet connection that is stable, and invite some of our community members who are here today to introduce themselves if they would like. Because we, again, as we indicated earlier, we're doing this work on behalf of individuals in the community who have experienced the state-sanctioned violence and do want to ensure that we hear their voices. And it is a webinar, so if you would like to introduce yourself and make a comment about your family member, please do so by raising your hand or putting a comment in the Q&A chat.
Should I go over this table?
Okay, well, it looks like the tables are up and a bit visible. So yeah, why don't we continue with your presentation, and we will go back to the participants who have their hands raised. Thank you, LaDonna. I see you.
Okay. Yeah, so this is just, I don't have to spend any time really on this, but it's just some demographics for people who are interested. But as I said, our sample is younger and mostly female. If we can skip to the next slide. So one question was, what level of exposure have people had to the police in general? So there's some numbers from the Bureau of Justice Statistics that said about 24% of the population have had encounters with the police, but we saw about 46% in our sample had
So, unfortunately, I do think that we're really having some challenges with our technical issues this evening. So I do apologize. Um, I think what I'd like to do is open it up to some questions, and these questions can be addressed to um, Melissa as well as our research team, and perhaps moving forward, we can answer questions about our survey, and we can also allow, again, as I mentioned, those individuals who would like to introduce themselves to do so, and we can make this presentation available for a later viewing. We have done this presentation for APHA, and we have a pre-recording. We have a recording of it actually that we can also make available on our website. So I think moving forward, that might be the best thing to do, given that our internet seems to be unstable for multiple presenters. So it looks like there are a couple of hands raised. And Michael Barber, maybe you can allow people to introduce themselves unless I have to actually introduce them. Okay. Nope. Okay, well, why don't we start with some of the questions that are in the chat? There are a number of them, and I will start with, I believe the first name is maybe Chris. Is this Chris Mitchell? As a person who has had a loved one killed by the police, the anxiety of not knowing if you will be the next, and the fear of having killers living among you, and the letdown of the system that claims to protect you, the vulnerability of the victims, because the victims' families are victims as well. He's discussing the depression that is not only as a result of their loved ones being killed, but the attacks that they've had to endure for mourning the loss of their loved ones. Not only fighting for their justice, but fighting for their family members who have also been threatened by the Vallejo police as the next target. I believe this is Chris Mitchell. Chris Mitchell. Thank you, Chris, for your courage, and we appreciate you bringing your story to our Vallejo community. There is a question from author Carmago to Melissa. Does it seem possible to repeal the qualified immunity?
Okay, I think I was seeing some stuff in the chat. I think that was Cindy Mitchell, who and Chris Kelly. They're both family members of Mario Romero, who was murdered in 2012.
Thank you.
And so I think there was some crossover between the two of them. I can't go back in the chat, but I think that's what went on there. But they're both ladies. So yeah, qualified immunity, in my opinion, is kind of a red herring. It comes up. You keep hearing repeal qualified immunity. That qualified immunity has to do with whether you have civil liability, like financial liability. It's not going to stop police violence per se. It's something that occurs in a very small amount of cases. And when it does happen, it's usually like lawyer error, if that makes sense. It's one of those kind of things that if you fail to properly assess early on in the case whether it's something that's viable under the law, and then you get in a situation where the judge says, your client was shooting at the officer and the officer was shooting back, and that is not per se unconstitutional. You get into things like that with qualified immunity. And in the 9-something years I've been practicing civil rights law, it's been applied to a case that I worked at once before I was a lawyer, while I was still like a law clerk in law school. Looking back at that, it was litigated poorly. And so it's just something, it doesn't happen often enough to really be a deterrent. It only happens when you have something that happens that's fairly unusual, or it's like bad lawyering. And so we heard it a lot last year, like, end qualified immunity, end qualified immunity. That only applies to federal civil rights cases in civil court. And so the deterrent on that, if you ended qualified immunity, for me personally, it would have really very little effect on the practice of civil rights, because it just doesn't really come up nowadays, even more so, because it used to come up more so before there were body cameras, before there were surveillance on it, because it would be a matter of, the judge having to decide whether it was somebody who was telling the truth or not, when the person who was killed can't tell their story. For the most part, now there's footage of the of the incidents, and so it's coming up less and less. And so it's, I think, less of an issue about taking away qualified immunity, and really focusing in on getting police to be compliant with the Constitution, because right now they're trained to follow state law, and the Constitution is federal law. It trumps everything. I had to interact with a police officer a few days ago because my dad's house was broken into when the guy was still in the house. And so it's like, we were either going to beat him up or call the cops. And we opted to call the cops, because I figured at that point I felt that I was more dangerous than the police were, because it was personal to me. And I had somebody there with me, I had another fellow advocate that was there with me, and we made the call, and we were observing what they were doing to ensure that they didn't hurt the person. And in that conversation with the officer, it turned out that I'd sued him before for killing one of my clients, and in another city. And so I didn't make the relationship to where in Solano County. And when the guy was in custody, he asked me something that he thought would maybe be inappropriate, but he's like, "Can you tell me what I did wrong?" And I was shocked, because I'm like, "You murdered this guy. What do you mean? What did you do wrong?" He had been told by the department that he acted within policy, and that there was not, that they'd followed the policy, and that there should be no repercussions for what he did. And he had no real understanding that he had violated the Constitution, and that trumps whatever your policy. It doesn't matter if your policy can say you can murder people. It doesn't mean that you're not going to, be doing something that violates the federal law. And so ultimately, this is an officer who had been with Oakland for like 20 years, and now with the sheriff's department for a short period of time. And never in any of those large departments had anyone ever told him that there are certain things that the Constitution requires. So they're not being trained to comply with the Constitution. Getting officers up to speed on what their constitutional requirements is a better focus than the qualified immunity thing. I'd say it all the time. It's a red herring. It's something that it's a breadcrumb. It's like having implicit bias training for racists. It's like throwing this tiny crumb at the community of something will have very little actual impact on the day-to-day civil rights violations, if that makes sense. It's hard to explain sort of the entire doctrine of qualified immunity in federal law in the time available. That's a whole class probably, but I do personally, from working on it day-to-day, it's more of a red herring. It's more of a thing that even if we get that, it's going to make such a minimal impact that the resources should be directed at things that are more important than that at this point, I think. I mean, it's when we're doing triage, what's the thing that's going to cause the police to stop killing people? The end of qualified immunity isn't going to stop the police from killing people.
Thank you, Melissa, and thank you for that question. And I think we're going to try this one more time. I think we have a stable internet connection now, and Dr. Caesar is going to be able to continue to present these findings. Thank you so much for your patience.
Yeah, sorry about that. I'm not sure what happened. My internet just went out. But yeah, so we were looking at zip code, some of the different zip codes. We didn't really find a lot on race, the interaction between race and police practices. That could be because, we've kind of undersampled for some racial groups. But that's something that we're still kind of exploring. But the zip codes, I mean, we found some of the questions that the police practices inventory asks about are, have you, and this is asking about if you personally had any of these experiences, but have you been hit, punched, or beaten by the police? Has a gun, baton, or weapon been used against you? Has there been forced sexual contact that you've experienced from the police? Has there been threatening, intimidation that people have experienced from the police? And then when the police have been called, has there been no response? So you can kind of look at some of these numbers here, and yeah, for the first one, hit, punched, and beat, you see you have a mean for 94589. You have a mean of 2.59, and then 2.35 for 94590, and then 2.15, and then 2.24. And that's that pattern you kind of see across the zip code. That's what the bar graph on the bottom is showing you. So this is if you kind of break up the experience in the based on the individual incident, hit, punched, a gun, baton used. But if you collapse them across these incidences and look at the type of experiences people have had personally, the type of things that they've witnessed, and then a combination of the two, you can see that 94589 kind of by far has had highest both personal people in that zip code have had the highest kind of personal exposure to police violence and witnessed exposure to police violence relative to some of these other zip codes. So this is, there's a lot to this, looking at some of the different demographics within each zip code, and then, things across zip codes. But I thought this was an interesting way to kind of look at the data and understand some of these experiences. And also potentially, a good way to think about how you go about targeting intervention and support services, by looking at some of the experiences people are having in these zip codes. So when looking at some of the correlations, to what extent are these things related to one another? We looked at total police practices, personal exposure to police violence and witness exposure to police violence, and then correlations with, physical health. The GAD-7 is about anxiety. The PHQ-9 is about depression, and then the mental health impact. The post-traumatic cognitive inventory is PTCI, and then that can be broken up into negative cognitions about the self, about the world, and then self-blame. So I have PTCI highlighted because you see there's a pretty strong correlation. I mean, the strongest correlation you can get is 1. The weakest is 0. So we have a correlation of 0.4 between total exposure to police violence and post-traumatic cognition. So suggestive that there's some kind of relationship there. And that was kind of what we were predicting. You see strong correlations between total exposure to police violence and depression, the PHQ-9. And if you wanted to break that PTCI score up, you can look at negative cognitions about the self, moral, and self-blame. And this is numerical. This is not something to interpret deeply, but for personal exposures to police violence, you see kind of higher correlations with negative cognitions about, the self, negative cognitions about, the self and others, but you don't really see a high level of self-blame, but you see a self-blame a little bit higher when people have witnessed other people, experience police violence. But regardless, the correlation between post-traumatic cognitions and police violence is pretty high. And then when we did the regression analysis, looking to see if there was an interaction between, exposure to police violence and post-cognitive thinking, post-traumatic cognitive impairment, we see that, there's kind of an enhancing effect. So if you have a low exposure to police violence and low post-traumatic cognitions, your depression score is going to be low. But as your exposure to police violence increases and your the negative attributions that you have, like your negative interpretations about that incident increase, then the depression scores go up, right? So you could have, low post-traumatic cognitions and a high level of exposure to police violence, and the depression score wouldn't really be too different than if you had low levels of exposure to police violence. So the attributions, or the way that people interpret, that event, really has a big impact on how they experience, some of the after effects from it, particularly with regard to depression. So just to wrap up this part, so, exposure to police practices seems to be higher than the national average in Vallejo. It's correlated with worse mental health outcomes. So the more exposure one has to violent police practices, the worse depressive symptoms are, and the greater those, greater the impact those symptoms have on someone's ability to function. Post-traumatic cognitions also correlate with exposure to police practices, such that greater exposure is associated with higher post-traumatic cognition. And individuals with high exposure to police violence and high levels of post-traumatic cognition had the highest symptoms of depression. Of these findings extend previous work demonstrating that violent police practices pose a public health threat, and suggest that interventions targeted around post-traumatic cognitive appraisal may reduce victim suffering. I can talk about next steps. So, our goal is to kind of get this data published, to get it out there in the world, and to continue building community partnerships, and including applying for various kind of funding mechanisms based on, community need. And to continue to push, this subject in public health spaces, in places like Touro and other spaces where people, for whatever reason, don't really seem to be paying a lot of attention, to the fact that, a lot of people are experiencing, either personally or witnessing, violent police practices. And it's having an effect, long-term effect on their ability to function and their mental health. So, in the interest of time, I think should I wrap up? Talk about these things. What do you think, Gail?
Yes, I think this next slide would be a great wrap up.
Yeah. So it's, our goal was to kind of highlight the importance of thinking about, police violence as a national public health issue. And, as Gail mentioned, we presented this at a national conference last week. We do want to work with the African-American community in Vallejo a little closer. In the world of COVID, that's a little bit harder, but to boost the recruitment efforts in those communities, so that people who have been victimized, by this, they do have, another avenue for having their stories told. And that's, another goal of this work is really boosting, the stories of the victims, the voices of the victims, people who have been, exposed to this, getting some numbers behind it. But more research is needed to understand the impacts of exposure to police violence on Black and Brown communities, but also generally speaking. And so toxic stress, elevated levels of stress can lead to long-term health impacts, poor health outcomes. So I think it's important to kind of understand these things, put these pieces together. so that we can, build programming around intervention and improvement for certain communities.
Well, listen, thank you so much, Dr. Caesar and Anika, for presenting the results of this study, which is we're really at the very preliminary phases of this work. So I want to really appreciate and thank Touro University for their support of helping us engage the community in these efforts, and understanding that we are really at the early stages of this work. I think I want to point out, I think I forgot to mention this in the introduction, when we first started these conversations, as I mentioned back in 2019, Melissa came to us to really request and talk about really having a space and a platform for victims, the victims of families of police violence, and really looking for that space, as she talked about, for people to actually even come together and share their stories and have a safe space to communicate. And so I know that that's one of the areas that we unfortunately haven't been able to make those next steps towards, because after those initial conversations, as we all know, we've been isolated as a result of this pandemic. So in addition to the next steps that Dr. Caesar mentioned, that's something we would love to revisit and engage with families a little bit closer to figure out how we can be that vehicle to provide that space and that platform to have a safe space in combination with therapists and social workers and individuals who can really provide those important resources needed to move forward. So I forgot to mention that earlier on when I introduced you, Melissa, and this work. So we don't have much time. Unfortunately, our internet connection problems has shortened our time here, but I do want to allow any questions, and I know there are a number of questions in the chat, and I'd like to ask individuals to put your questions in the Q&A, just to make it easier to dissect all of these questions here. And
yeah, I see a question from Chris Kelly. I'd like to know how many directly impacted families who had loved ones killed by Vallejo police were exclusively contacted and included in the research. That was our primary, goal. This study really was kind of meaningless unless we could do that, which is why Melissa's input and all of the community partners that we mentioned, including Vessels, including the frontline activist movement, Rob Reason, who's family member of Eric Reason, the Willie McCoy Foundation, were all contacted, and information was presented to them about this, and they kind of saw the value of it. Rob also was a panelist on the social justice series before. So no, that's not sufficient. Killed by police, Vallejo police. Yeah. So we could go back to the community partners slide, but the frontline activist movement was a coalition of families who were who had family members killed by the police. Right, Rob's cousin was not killed by VPD, but the other families that we were working with were. So and this was kind of an attempt to reach out to some of these families and get their input on the study and support on the study, because it really, unless they were included in the research and represented the research themselves, it wouldn't really make much of a difference. But there are lots of people who have been impacted by BPD practices, and it was not nearly comprehensive. So there's always more work to do.
Yeah,
I'm
to
going to
that
have to.
point, I think there's always, the work is ongoing. This was very preliminary. This was the first phase. This was also launched during COVID. And as I had mentioned, we definitely did not reach everyone that we wanted to reach, especially because we had to use virtual measures. And that definitely limited the sample size as well as the capacity that we could make more personal connections with impacted members of the community. So the second phase, we really are hoping with, the Delta variant and COVID still ongoing, that we can find another way to outreach more of the community, especially those impacted, so that we really can get their voices in the survey. And we also are looking at kind of having more disseminations of the data and more focused talks with our partners after this, once we have more of the numbers, to really see their goals as well on how to help the families.
And just to reiterate, if you can put your questions in the Q&A link, that makes it easier for us to go through and answer the questions. And I know there are a couple of folks who have their hands up, so please put your questions in the Q&A link. And we have a question from Arthur. How can we get more transparency in terms of the officers that habitually act in violence?
Might be a question for Melissa, maybe.
And the transparency part is the big issue. I mean, a couple of years ago, there were state laws that were passed that resulted in more transparency. That's why we're learning about a lot of this stuff. Some of those laws were used to get out some of this information. There's still a lot of things that are being hidden because, even when we go and litigate things, it's hard for us to figure out what they're hiding from us. And so there's a long history of, even with the newer Public Record Act laws, for the city to still be concealing some of the worst of the worst stuff. I mean, we just, last year found out, through media and public records and various other, methods that the police were bending their badges to celebrate killing people, and we're still waiting to find out what the city, they hired a former cop to investigate that, and have been making promises about the findings of that. But it really can't, it's a matter of having, kind of being in the know of what's, what we're waiting on. Like, people can call the chief of police and say, what's the status of the badge bending investigation? Because they've been investigating for 16 or 17 months, and they're telling the courts, oh, we're going to be done in August or September, and now we're in October going into November, and we're still waiting on that. And we know for a fact that there's multiple officers in the department still currently right now that are driving around. And a good point, like, we want to know as community members, so when we run into one of these people, we know that, there's a person that could potentially murder you and go and celebrate, go and do this ritualistic thing. But it really takes pressure from the community to create the transparency. When we try to create community pressure, it just ends up normally being the impacted families coming together in a very small group of allies. And so we need more people to create the pressure to force and compel the transparency. I guarantee you right now, if 500 people showed up at the police department tomorrow morning and demanded to know what happened with the badge bending investigation, I guarantee we get a response. And probably shortly after, they'd release the report, which, my understanding has been done for quite some time, but there's no pressure. And so a lot of the transparency has to do with who's going to get up there and scream at them and insist that they do it. And what oftentimes turns out is that it's not going to be anybody but the people that have already been harmed, the people that understand the loss and, are going to be the people doing it. So a lot of it is just really, what do we individually as community members, what are we going to demand from the city? They're not going to be transparent if we don't make them. We all have to raise our voices and do our individual responsibility for demanding that they do that. There's not some outside source that's going to make the city of Vallejo transparent. A lot of people are going, well, the DOJ is going to come out on Monday and they're going to do this panel and whatever. I'm literally fighting the DOJ who's defending police officers that have murdered people. That's not the solution. There's, when the most notorious cases that I've worked on, the Attorney General's office, Rob Bonta's office, who everybody thinks is like the savior who's going to come and reform the police, They're actively defending some of the worst cops in the state. The entire California Highway Patrol is defended by the Attorney General's office. And so we have this belief that somebody else is going to save us, that we can do something to make them transparent. And it's not. It's a matter of public pressure. The people in these communities have to bind together. It doesn't take a mass of community members to make them do things. We've seen that in this pressure that we've been able to put on the city in small numbers. So imagining that all of the people that have the questions of what we can do, it's not what we can do, it's what can you do? What can you as an individual do to make those calls? Contact the city council people, contact the mayor, contact the city manager, contact the chief of police, and be the squeaky wheel. Because I have found that that public pressure has compelled them to have to be transparent in areas where they normally wouldn't be, but it just can't be us continuing to expect that some other government agency that's part of this entire status quo is going to come and fix the things that we're dealing with locally, because it's maybe a little worse in Vallejo, but it's not a lot worse. I mean, we've got some corrupt police departments. I can tell you stories of things that would turn your stomach, of police agencies across the country. And so I just want to disavow people of the belief that that there's some outside thing other than you as an individual putting your body and your voice on the line. When I started doing police advocacy, I was getting death threats, and that was the cost of me trying to create transparency and exposure to this thing. And so it's, what are we willing to commit to getting that transparency, to getting that equality, to getting the police department to do something different? And it's it's us. We're gonna have to be the thing to compel that transparency.
Thank you, Melissa. And it looks like we have one question in the chat, and I know in the Q&A link. And so this is from Chris. Was any compensation provided to impacted families who helped support your study? This was not answered. Has Touro received any grants or support to help with these study efforts? I think we mentioned earlier, Chris, this is a great question. This is a very preliminary study that was made available from an intramural grant from Touro University. So there were no foundations or grants that were provided for this work. One of our areas or directions for next steps is to seek funding so that we can provide those resources to those families in the future. So unfortunately, that was not a part of this current study. But thank you for your question.
And I just wanted to mention, I always try to be as transparent as I can be. I receive compensation for being here today, and that money goes to the Willie McCoy Foundation. I don't take any money at all for anything I do in attempts to advocate for people who've been impacted by police violence. So I always try to mention that, because I can't sell other people's stories. I'm talking about their pain and their hardship, and they're not here to be able to accept that. So I have to accept it on behalf and turn it over to the nonprofits that are trying to work on those things. So I just want to mention that as an aside.
Besides the incentive, we did, when speaking with the partners on strategizing, because they really were the ones doing the outreach with their contact lists and their social media. And because, again, everything was virtual, we decided to give each of our partners a stipend amount in order for them to be able to meet the needs that they needed at that time to help their members. One in particular, in regards to the comment for the unhoused community, was Vessels of Vallejo. We understand that they, often have encounters with the police, and they are a group that is hard to reach during this time. And so Vessels was really great about doing the legwork and actual physical outreach for us. And we did the stipend in that way for them, as well as we are looking at forming a clothing drive for needed items for now to help, and also strategizing on the next phase as well on how to fund as well as outreach.
Thank you, Anika. And I'm looking at the time. We are actually over time, and I just want to close our segment and appreciate Melissa Nold Alan Caesar and Anika Lee for this presentation today. This is obviously the beginning of numerous conversations that we will have on behalf of this very important issue that is facing not just residents, victims of violence in Vallejo, but is really universal and important as a public health issue. And I'd like to appreciate everyone's participation and thank you for attending today's seminar. We have one more seminar that will happen on the 14th of November, so I invite you all to participate. And also understand that as a new program, we are working in multiple levels to try and engage the Vallejo community and leaders in Vallejo to really hopefully be a part of making some transformative change for the city and its residents in partnership. And so I do thank all of you for your participation, and we hope to see you again. Any additional information you'd like to share, I have my information that I can provide in the chat. If you have additional feedback, and I do apologize, we can't get to all of your questions this evening, but thank you for attending. Good night.